Today I am joined with Jennifer Stewart. We've had a couple of chats in the past on the Shake Talk, and Jen is kind of becoming a bit of a lean on for me, certainly when it comes to the world of massage techniques and certainly questions that many of you have. If you are new to my page or to the lipedema world, you have questions, and massage may or may not have been a part of your life prior to what you suspect you have or have recently got as a diagnosis. But there are some things to know that are vital as part of your self-care, as far as understanding what role massage can play. But more importantly, what I wanted to sort of hone in on today is the person offering the massage. What is their level of understanding of the condition that you may or may not be dealing with? So Jen's a very busy massage therapist and certified lymphatic therapist as well, that has given me time on her vacation to listen to me ramble and ask her questions. So thank you for joining me today, Jen.
Yes, absolutely. So glad to be here with you
Tell
again.
us kind of where you're from, what you do, an intro, because not everybody has met you, I'm sure.
Sure.
And Jen's made some informative notes today to sort of cover. There's so many things we could talk about today, but I wanted to appeal to those of you that are just learning about self-care, and perhaps offer some tips, or dispel some myths for those of you that are unclear on what type of a role a person like Jen can play in your self-care.
Yeah, absolutely. So my name is Jennifer Stewart, and I'm from Fort Smith, Arkansas. And I have been a lymphatic therapist for over 12 years now, a massage therapist for 14. And I've worked in the world of oncology. Now I'm practicing on my own to help women like you. I am a self lappy girl. I have lipedema as well. And I am also undiagnosed. It is very hard to get a diagnosis here where I live, in the great state of Arkansas. Anyway, but one of the things that I really want to kind of touch on today is self care and what it is that we can be doing to help ourselves in our daily lives. Um, are you seeking MLD? Do you know what MLD is? Are you seeking regular massage? What is it that helps you get through your daily life? Because we know that pain is a big issue. Um, there are so many things that we could talk about as far as diet, exercise, and all that. That's for another day. I really want to just talk about things. First of all, we'll talk about MLD. What is MLD? It is manual lymphatic drainage. And if you are seeking a therapist to help you with the manual lymphatic drainage, you need to seek somebody that is certified. If you're living in the United States, I don't really know about Canada.
Yeah, there's some
How
guidelines.
they,
Most
yeah,
most places have guidelines, but they may have different names.
okay.
Yeah.
So, what it means to be certified is just that I've gone through a lot of training to learn lymphatic drainage. As a massage therapist, we have to go through continuing education, which is 18 hours every 2 years. Um, but when you're doing that, if I just go take a little 8 hour course or a little 10 hour course, I can't come back to my office and say, oh, yay, now I've done a lymphatic course, so I'm certified. So that's just how it is here in Arkansas. You have to go through a big, rigorous training. I got certified through Vaughter Institute, which is world renowned and a very good place to get your training. But as far as the MLD, it is a very light massage. It is a massage that is directed in a specific direction. And when you're talking to somebody trying to figure out if I need to see this person or not, are they trained in their knowledge? You can just ask them, do you know the sequence, or can you just tell me a little bit about where you were trained? But it's a certain sequence that we will do, and you can even pull up videos on YouTube all day long about doing self lymphatic massage, which
Good
is
idea.
great. Self massage is a really good tool. And that's one of the topics that we've kind of brought up today is MLD versus tools.
Okay.
Whether that be a vibration plate, whether that be a massage gun, whether it be there's so many, a dry brush, your hands, the leg compressions.
Yep.
Yeah, there are tons of tools, and they're all good tools. They're all really good tools, and I use most all of them myself. But when it comes right down to it, the actual massage, the actual lymphatic drainage is something that you need to be doing on a regular. What is a regular? It's whatever your body needs. Some people need to do it once a week, some once a month. It just depends. You'll figure it out with your body once you start getting that. Is the vibration plate as good as MLD? Well, it's just a tool to use. And yes, it's great as long as we're using the lymphatic therapy along with it. Anything that moves the lymph. The rebounders are great. So self-care is the tool, not really what you're using, but the self-care.
And consistency in that self-care.
Consistency. Mm-hmm.
I would say, to add to Jen's point, the tools, and MLD itself being an approach, a tool, if you want to call it, but that there's never going to be a perfect blueprint of, okay, go see Jen, then use your massage gun for 3 minutes, then step on vibrate. It like anything else. I know you hate it when I say this, folks. You're going to have to experiment, because the goal, if you're doing the good work and things are improving, you may need to change, you may need to adapt. And addressing Jen's how often, it does depend on you, what stage you're at, how clogged up those lymphatics are. And the tools to me would be more synergistic complement. So if you were going to see Jen for an MLD, many of you have seen comments, I would have you go a couple minutes before and after on the machine to enhance versus be a replacement of.
Yeah. Well, and you might be even asking, well, so we all have stagnant lymph. It doesn't matter if you have lipedema, lymphedema, it doesn't matter. We all have stagnant lymph. And that stagnant lymph, especially for us girls that have lipedema, it occurs around our joints. Mm-hmm. And that's whenever we have the subcutaneous tissue or the connective tissue or the fascia, whatever you may want to call it. This is why we're getting so much pain, is because of that lymph is stuck in these connective tissues. And if you're not doing anything, then this is one reason you're having so much pain, is because the lymph is collecting and you need to move it out of there. You need to get it out of the joints. You need to get it moving in the legs. I know that's probably one of my worst areas, is my legs, but the stagnant lymph is increasing pain. It's increasing the achy, like I would call it restless leg type feeling. It's increasing the numbness. A lot of us tend to have the peripheral neuropathy, and especially in the feet. And so that is a lot of that for us is just stagnant lymph. We just need to move.
When we move, lymph moves. So, circling back to the tools, how often you need to move, how often your lymph needs help. And just keep in mind, it's taken years, even decades, for some of you to get to this point. Consistent, not overuse, but when you're starting some of these tools, there's other things like detoxification and how it plays in with our immune system. And sometimes after you've had a massage or even used the vibration machine maybe for too long of a period starting out, a comment I get is I feel kind of sick, kind of fluish. Is this a common thing you get when folks are starting out?
Yeah, absolutely. Because we're helping you to remove so many of those toxins. And that's one of the things that is so flooded on the market these days is a detox tea, or use this for detox, this detox supplement. That's those are fine, but if you're not doing anything to detox the tissues,
Yeah.
then you're basically failing yourself. You've got to detox the tissues. And so that's about that's what goes on when we are doing the MLD, is we're helping to detox all that junk that's caught in your tissues and those connective tissues. And so, yeah, absolutely. I'll have somebody, I had a girl that she's a breast cancer patient, and I did my first treatment on her. And I said, now listen, after today, after this visit tonight, you're going to maybe feel flu-like, you might feel a little achy, just drink plenty of water. And she was like, oh, I've got this. I've had a lot heavier massages. You didn't even hardly touch me today. And let me tell you, she felt like crap the next day, which is people sometimes will actually schedule their appointments so that they can have them done where the next day they're not doing anything. Because when you have so much junk in there to get moving, you're going to feel like crap the next day. You'll feel really fatigued, kind of let down.
But that's a great point. And for the same reason, I recommend, whether it's the Vibe machines and you're, just getting started, or saunas, anything that ramps up that detoxification. I don't know how your body's going to react. I don't know how toxic you are or hydrated, yada, yada, yada. Constipation is another thing that happens if things get moving and you need to be on the toilet for 4 to 5 hours the next day. So that's a great tip. If you are going for a first time massage, it does ramp up that detoxification. It's maybe good to plan some recovery time after the fact if possible. Great tip.
Absolutely. And also, another big thing to remember when you're going through your first MLD session, or you're getting on that vibration plate for the first time, or you're getting in the infrared sauna for the first time, don't forget, initially, you're going to have some increased swelling. It's because we're starting to move the junk that needs to get out of your body, and your body's like, wait a minute, I don't know what to do with all of the rest of this extra fluid. So you need to allow your body time to catch up with what you're doing to it.
And that's maybe a good area where the tools can come in, because you don't really know until things get moving. I've had personal experience where I kicked ass on this lady's legs one time. It was probably lipedema, but I didn't know what that was at the time. Moved all this fluid, and later on that evening, it was all up in the torso and the arms. So had, the system sometimes, as I said, years and decades for many of you to get this congested. As things get moving and flowing, you may need to help your system move things along in areas that generally may not have presented as an area of swelling in the past. It's got to go somewhere.
Yeah, definitely. So that is something that I do hear quite frequently from people or women that I'm working on, because that's typically, demographically, I see a lot more women, is, well, I did this first session with you, but I feel worse. My body is more swollen today. And what did you do to me? So there's a lot of, I try to talk to my clients a lot while I've got them on the table, letting them know the one thing I hear a lot, especially in my MLD sessions, is when I'm telling them you need to drink more water. Yeah. And they're like, oh, well, I drink plenty of water. I'm a big water drinker. Well, that's great. And if you are, then you need to be adding some of those electrolytes back to your body, because you may be getting rid of all those electrolytes, then you're going to cause yourself to swell more. But you've got to understand that the more our bodies are dehydrated, and the more, when I'm working on you and trying to help you get rid of all that stuff, the more you can go and be on the pot, the better we are, because that means we're getting a lot more of that stuff out of your body.
I think it's a psychological flip though too. A lot of my seniors, especially, not to pick on my 60, 70 plus crowd, but there's a, I don't want to run to the bathroom. Many of them are dealing with incontinence, these
Mhm.
types of issues, but there is, as I said, it's taken you years and decades to get to there's gonna be a period where your body becomes assimilated or gets used to this therapy. And there's some junk that's been stored up in the trunk. So it may take some time.
Mhm.
Maybe it's a matter of doing it early in the day so you can get the peeing done and the pooping done throughout the course of the day and have some sleep at night. Jen didn't quite go there, but the biggest thing I would want to say is don't stop because you've had a poor experience. You can't expect
Absolutely.
one massage or one shake on the plate to be the impression. If you were going to see your doctor for medications, you would give it at least 30 days because your doctor told you. So if you are going from an MLD the first time, whether you're in a very progressive stage with your health or not, just be prepared and expect and plan that it doesn't really come as such a surprise. And you're more than likely to continue. You got to keep that process going. Otherwise, you're never going to get things moving.
Yeah. And
Really.
your body will catch up. It will. You just have to give it a second. Like Deb said, you didn't get to this point overnight. So one session, one vibe is not going to take care of your issue.
Now, that being
Uh,
said, some of you do have very extreme reactions overnight when, I've seen people go 15, 20 pounds either way. But
yeah,
that just speaks to how much is in there that has, been hung up. And on the water thing, I want to circle back here. Many of you that say, I'm no, I'm good. I drink lots of water. I find that is rarely the case.
hmm,
Many of you are more concerned, if you're on water pills right now, I'm not saying don't take water pills, but that there's your body is 70 to 80% water. We need the fluids, otherwise, you're just setting yourself up for other issues. No better than Jen or I what state of toxicity you are in, and just be honest with yourself. If you're coming from a place of cheeseburgers and fries and cigarettes for the last 3 to 4 days, I would expect maybe a little bit more reaction than someone that's provided the body structure and nutrients. Any type of movement when you're moving the lymph and working on detoxification, it does wash out some of the good with the bad. So to Jen's point, you need to make sure that you're offering your body nutrient dense foods and hydration to support this increase in lymphatic activity.
absolutely. And be kind to yourself and be kind to your body. And don't think because you've had a bad response to your first session that that's how it's going to be every time. So just and be gentle. Don't
Enough. That's
don't
enough.
write it off because,
Make sure that
like you said, we didn't get here overnight.
No, I had a talk earlier this month on nutrition, and I guess I kind of knew it, but I didn't realize how prevalent it was that many, particularly within the lipedema community, because of the battle with the food and the exercise and so many of the stupid stigmas out there, most of you aren't eating enough anyways.
Yeah,
This isn't a
exactly.
calorie game, and that all lack of food contributes to a more severe reaction or response in some cases. So that's another chat for another day, but I had to drop that one in there.
Yeah. Well, a really quick fact about protein. If we're not eating enough protein, it will actually cause us to swell more
Interesting.
because our body needs that. So real quick, just because I live in Arkansas and I'm at the beach today, but down in the Gulf state, um, one of the best things that we can do for ourselves for self-care is get in the pool
Mm-hmm.
because the pool is causing hydrostatic pressure, which is acting as a little MLD session. Um, so it's summertime and the pool time is fun. If you've got kids or grandkids and you can be out there with them enjoying that, you're enjoying your day, but you're also helping your body
Yep.
with the hydrostatic pressure. And it definitely will help to reduce some of your swelling.
It's a hard thing for some because of the mentalities over the bathing suits and so forth. But you know what? Um, it's a you'll feel better after if you can find a mental place and find some joy in those activities
Yeah.
versus quit beating yourself up so much, I guess. Is that what
Yeah. I
that's my
mean, I have tons of women, and that is always their response. Well, I'm not putting on a bathing suit. Well, I'm not asking you to put on a bathing suit.
put on some
You've got some
t-shirt.
capris and you've got a shirt. So get out there with that on. Nobody's going to be looking at what you're wearing, I promise.
There's not just lymph and things being detoxed out of your system. Can you maybe brush on the mental health aspects of something like the self-care and the massage? I think it's a big one.
Yeah, absolutely. I think lipedema and lymphedema especially is just such, yeah, the physical aspect is a lot. Our health is a lot, but our mental health is such a struggle.
Yeah.
Because we do all the things. If you are eating enough protein, you are having a correct diet every day, day in, day out, and you are that person, it is so mental because you want to see the results of your hard work and you don't.
You
And
deserve the results of your hard work. Yeah.
yes, yeah. And so you may not be seeing them visually, but I know that the way I feel is much more of a testament than to what I look like on the outside. However, I'm just going to be honest, for somebody that has lipedema or lymphedema, that's not saying a lot. I mean, because, well, I'm at the beach right now and you can walk down the beach and see what other people look like. And that's a mental thing because you know that you will never be there. Um, it, it is a very big hardship on your mentality. So you really have to stay positive. You have to keep reminding yourself it's not about what I look like, it's about
How I
how
feel.
I feel.
Yep.
Like, not how I feel, like my emotions, but how I feel. Am I hurting today? Do my legs hurt today? And my job, like we talked about earlier, my job is so physical. And here lately, I've been working way too many hours, 10 to 12 hours a day on my feet. And it is very physically taxing. And it's also very mental. But if I'm not taking care of my body and feeding it the right things and hydrating, then I can't do what I love to do. And so just try and find that thing. Mine is Bible study that I try to do in the mornings. That's what helps me mentally to try to get through. But if whatever it is, if you meditate or whatever it is, that you can get to that mental state of just trying to learn and get right with yourself, that all this appearance and stuff that I have doesn't matter. It's about how my body feels.
I had someone mention last week, if you can't do it for yourself, because sometimes, as moms and as women, everything else aside, it's selfish. We always put ourselves last. If there's not enough food, we wait and make sure everybody else gets a plate before we even dish up in a lot of cases. So throwing lipedema or lymphedema, and, keep in mind, if it's not for you, do it for someone that is relying. Maybe it's your kids, maybe it's your parents that you're caring for, make sometimes it's about investing in your self-care, because you are the caregiver as well, right? So whatever way you can find to motivate you, whether Jen with her Bible studies in the morning, maybe it's meditation, maybe it's starting some MLD because you've never done it before. I absolutely cannot stress enough, if you have not sought out this type of therapy, it's sometimes it's a matter you don't have access to somebody, as Jen said, but do your homework, and I think you'll be pleasantly surprised with how much it can really contribute to a lot of positives.
Yeah, and talking about massage, a regular massage. So that is one thing. If you go into somebody and you're requesting a regular massage and you want them just to get in there and just really work the muscles deep, and yeah, that really does feel good. But what happens is our body's response to that deep work is inflammation. So you need to have somebody that knows what they're doing. And if you want that deeper work, to get the deeper work, but then you need to follow up with the MLD session. Like cupping is great for MLD or for lipedema and for breaking up fibrosis. It's great for lymphedema. There are some, the vibration gun is really great for breaking up fibrosis. But you need to understand that all of those things that are super hard, firm pressure causes inflammation. So then you need to follow it up with the lighter work to get that inflammation out to where it needs to go.
Help the system as a whole to move things along.
Yeah.
Even if you're going for an MLD, you're doing, you need with this, if your system, especially if it's very compromised, to expect, maybe some reactions, but, facilitate and help move things along. I've seen that with a massage and bruising, because if you're new to the lipedema community, because, maybe a deep tissue massage feels great. But if it's not something you've been doing regularly and you don't have a good relationship with your therapist, it may be something to work up to or in complement with. I sometimes, like Jen said, it might feel great at the time, but I have seen some women unaware, maybe didn't have a diagnosis, thinking that's the best approach, even with a massage gun, more pressure, and left themselves kind of marked up with some bruises the next day, which is common in this community.
Yeah. And it's not always, a lot of us think, well, no pain, no gain. Well, that's not true. That's not even true with massage. But us with lipedema and lymphedema, our bodies will respond a lot differently than a person that doesn't have lymphedema or lipedema to the firm pressure, to the massage gun, to the cupping. I can't tolerate cupping myself, but I do have clients that can tolerate cupping, and it's a very successful tool. However, I always will follow it up with light work, because it's what's
localized. The guns that if you're working a specific area, you've got to help that lymph dissipate and move along.
Yeah,
awesome.
And that's something. Also, just a quick little note. If you have a lot of scar tissue in the area, most of us have had surgery. And so if you've had any kind of surgery, most likely they have used some kind of a cannula to go through your belly button. So you have scar tissue there. If you're a female, you've probably had a hysterectomy. A lot of us maybe have had C-sections. So you're developing this scar tissue in the abdomen. Well, guess where a lot of our lymph lives is in our abdomen. And so if you got that big, huge belly and you're thinking, what in the world? A lot of it is lymph. And so you need to get rid of that toxic fluid that's in there and see your therapist.
Yeah, makes sense. And scar tissue, or recent surgery. Jen and I were talking before camera about why she's been just so darn busy lately. But if you are planning surgeries and your surgical team or your whoever care provider has not discussed some recovery options, I think MLD plays a huge role in post surgeries of all different kinds. Can you talk a little bit about why that's important?
Yeah, absolutely. So first of all, if you're having any kind of surgery, post-operatively, you are going to have that swelling. And the MLD, of course, will reduce the swelling. But the great thing about MLD post-operatively is it actually will increase your healing time. So you may be going in to have the mommy makeover. And so we obviously know that you've got little ones at home, but that MLD is going to speed up that healing time. I get my patients that are coming in and they'll go see their doctor for their post-op and they come back and they're like, man, my doctor says I'm doing really, really good and can't believe how great I'm healing. And then I want to say, but I don't. I'm like, it's because of me. I mean, it's because you're getting treatment is what it's because of. But the thing that really I think irritates me the most is the doctors will not educate you. A lot of them will say, no, it doesn't have anything to do with what we're going to be doing for your surgery. It doesn't matter if you're getting a mommy makeover. It doesn't matter if it's cosmetic surgery. It doesn't matter if it's you're having a total knee replacement. It doesn't matter if you're having appendectomy.
You're gonna have surgery. You're gonna have swelling.
You're going to have swelling. That's just how our body heals itself. And so the lymphatic therapy, the MLD, is definitely going to amp up your healing time, and you're going to be up and moving around a lot faster.
A point I want to add, for the same reason that I, pre-post surgery with vibration machines, yes, you can use them. It's how you use them. So, lighter approach, just like Jen. But I would think that MLD post-surgery, first point, would help mitigate the development of scar tissue to a degree.
Absolutely.
That's another real important point. And prior to surgeries, if you do have them scheduled or planned, and with my vibe machines, I'm always like, use the machines, get to know them. The better your body can be functioning before you go under the knife, the confidence after using. But for the same reason, I would think MLD leading up to a surgery would be a viable tool, a tolerable tool, especially if you're dealing with, with chronic pain, knee joint issues. And it's, there's usually a workaround if you're working with me on a vibration machine. But if we're talking mass public, MLD is probably one of the few therapies, because you can't do everything right away after a surgery, but it is something that pretty much anyone to a degree can tolerate, regardless of how big or bad the surgery was. Am I correct on that?
Absolutely. And typically with MLD and post-surgical needs, you can literally start the MLD the same or next day from your surgery. Because it is so light, it is recommended that you start as soon as possible. One of the things I know a lot of the lipedema women I see are doing the liposuction.
Yep.
And if you are not utilizing MLD after you've had liposuction, then you're going to be stuck with a lot of these little nodules in the areas where they have done the liposuction.
Yeah.
And so it is prudent that you do MLD after liposuction. Some of the doctors or some of the patients that I'm seeing, their doctors are very great in telling the clients, yes, you need to go as soon as possible. But just for your knowledge at home, anytime you're having surgery, like Deb said, even before you get ready to go to surgery, having a few sessions will definitely help your surgery.
And it'll just, we're stressed out enough, the anxiety, you're going in, you're getting this done. Anything that you can do to help, as we talked earlier, it's a physical thing, absolutely. It'll help better prepare the body for what they're going to do to it next, but it's a mental thing. You're going to be relaxed. If anything you can do to just calm the nerves, if you will, prior, whether you've had surgery or not, there is anxiety associated to such things. Maybe not just the surgery itself, but you're not at home, you're not in your own bed. There's all kinds of things. We're good at that, psyching ourselves up and giving ourselves something to worry about. That's what women do. So yeah, pre-post surgery and even injury. So how many of you, I don't know, in the community have like hypermobile joints, poor balance, other things where, physically, things just happen. It wasn't necessarily a surgery, and I get lots of questions where people say, well, can I use my vibration plate? Well, you probably can in a modified way, but have you thought about MLD or massage. Sometimes
Yeah.
if you've had an injury, a sprain, or maybe you're just you're taxed and you're drained and you're depleted. There's lots of other reasons outside of the lipedema, lymphedema care, that this can really just help not only your body, but your mind as well.
Yeah, and one of the things that I see so many times, and this is not just lipedema, lymphedema, this is just even athletes, they will come to me and they've gone and ran a 5K for the weekend or something, and they're just telling me my knee is on fire. I can't move it. They have wore compression socks for their 5K. Well, guess what has happened? That top of that sock is act like a tourniquet. So now behind their knee, it is like a softball that is filled with fluid. And so MLD session is the best thing for that. I know a lot of us Lipey girls have knee pain. Just feel behind your knee, and you most definitely probably have fluid behind there. And an MLD session will definitely help that issue.
That makes sense. That
Mm-hmm.
makes sense. So
Yeah.
you
Well, I see
never
a
know,
lot of women that have a lot of lymphedema, lipedema women who have been instructed to wear a thigh high. And then I see them and they've got these huge,
Yeah.
pongs, I don't know what, to call them on the side of their
Yeah.
hips and their legs. And their abdomen is just like out to here.
Yeah.
I'm like, well, that's because you wore your compression here and now everything has moved up. So yeah,
It's
that
got
is
to
the
go
big
somewhere,
thing.
right? And the
And it goes,
doctors can't be the experts in everything. I mean, there's just so many things coming at all of us nowadays. You've got to invest some time and empower yourself with knowledge. I'm not doing these chats because I don't know about MLD and about what Jen does, but I do see consistently, it's you didn't know yesterday what you know now. And some women are like, oh, well, you didn't know about MLD ever, you didn't know till you knew either. And so
exactly.
to these doctors out there, they're so focused on the surgeries and there's other things that are taxing in their brains. And it's kind of like vibration plates. No, not everyone knows about them. It's kind of the same sentence with lipedema, but as time and pay, it's going to be a long time before even the standard of care for lipedema, you know, it should say lipedema surgery, and right after that, it should manual lymphatic drainage massage. But again, there's so many things being thrown at these doctors. You've got to look at not only empowering yourself with knowledge, but once you kind of look at some of these therapies, these tools, as Jen discussed, start doing some research in your area. Who's out there? Who's got experience with these tools? Who, is there somebody that opened 6 weeks ago offering massages, or is there somebody in your community that's been there 30 years because they probably have a clue? So yeah, look locally. And again, one thing I always like to talk about with any self-care is it's not about the vibe machines or the ML, it's always about a variety and you being curious enough to experiment and try some of these methods. Some are absolutely going to be more vital and more of a regular in your self-care. And I think you'll find if you haven't explored MLD, or for those that are doing it regularly, it's probably in the top one or two staples, not just in a post or pre-surgery situation, but ongoing care with these conditions. And me, the vibe machines, the tools, the pool, other things you're doing, that's where you can play with some of the variety, but you do need to invest time regularly in you, and some of these tools just facilitate that on the timepiece. But consistent regular use, consistent regular visits to someone like Jen, and what you'll find over time is the maintenance piece, I think, will kick in more and more. I don't want everybody thinking, you got to go do this 3-4 times a week for the rest of your life. But initially, when you first start some of these therapies, for all the reasons we've talked about, especially if you haven't been doing manual massage with someone like Jen regularly, there's going to be that assimilation period or getting used to where your body's got to go through this period of cleaning house and getting used to things. And please, please, please do not be deterred or scared away if you have a negative reaction. It's not uncommon. Reach out to people that have experience, or ask. If you're talking to someone that claims to be a certified lymphatic therapist, and you ask them, how am I going to feel after this? They should pretty confidently be able to answer those questions. They're not all going to be warm and fuzzy things, but I do find it's like the itchiness on the machines. If you didn't know about it, it can be really alarming, and what's going on? Because the sensitivity is even worse. But if I say, by the way, you might find a little bit of an itchy, pins and needles could be very severe, then at least you're kind of mentally expecting it, and that, even though it might be not the most pleasant experience, it's a common one, and it's just something, one of the steps you got to go through to get onto that regular maintenance piece of self-care.
Well, and just with the starting out, and once you learn that, my body's going to feel good if I do MLD, and if I use the vibration plate, or if you utilize all of these tools, but you're also going to find out if I slack off and I don't do them, then, I'm back in my same boat. And so you're going to learn your body. You're going to learn how things feel, and you're going to want to be more consistent.
Yes.
I hate working out. I just hate it. However, if I don't do it, then I know that my back is going to hurt. My legs are going to hurt. I know how my body feels working out versus not working out. And working out is my self-care. That's just my self-care. Yes, I vibe. Yes.
Taking steps. So that was a big admission that, most people don't love to work out. Most people are not exercise for purpose people, or there probably wouldn't be vibration plates. But you've also taken steps knowing, this is where I always say, be realistic and be honest with yourself, because nobody's going to do the work for you. So if you know you need somebody to kick you in the ass 3 to 4 times a week to make you do the work, Jen's working with not only a trainer, but that trainer also happens to have other skills. And sometimes it's a matter of not a big elaborate routine or going to the gym and killing yourself. It's a matter of finding some basic exercises that I want to say are dual purpose. Jen's got back issues, and she's got lymphedema, and she's on her damn feet all day because she's a massage therapist. So, there's usually a harmony in the things that you can do to maintain the self-care, but also offer you other benefits. Maybe it's strength, maybe it's, back pain relief. It doesn't mean that you have to do 20 different things for every deficiency that you're dealing with. So you're working with a trainer person. Tell us about that.
So I do have back issues, have shoulder issues, but a lot of mine are brought on from my work. However, a majority of my problem is from my lipedema. My girl that I have sought out, not only is she a personal trainer, but she is also a physical therapist. And so I love that kind of work. And it's not like a CrossFit or some crazy kind of workout. It is specifically designed to help my needs.
Yeah.
Yeah, she kicks my tail, but I also know what she's going to have me do is not anything that is going to hurt my body. And I have been so surprised lately at the things that I can do physically that I haven't been able to do in a long time. I haven't been on machines in forever at the gym. And that's what I like. I like that kind of thing. I like a hard workout, but my body hasn't allowed me to do it. And with her having the knowledge base of the physical therapy and the personal training, she knows how to handle my body. But then I also have to be honest with her and with myself, because I'm a very competitive person. And if she wants me to push tank down and back, which is, if nobody knows what a tank is, it's basically like pushing a tank that weighs 1,000,000 pounds up and down the asphalt or up and down the AstroTurf. And if I can't do it at the end, I have to be honest with her and say, my body won't tolerate it. And it's not me wimping out. I have to learn that.
It's just
I'm
boundaries.
not being a wimp. My body just physically can't
Yeah.
handle this last part.
Yeah.
And so I've learned at the end of a really super hard workout, and she's learning with me, that I have to do things to cool down and things that are going to help my muscles
Yeah.
not hurt as bad. Um, I was I was doing a little bit of a study about lactic acid, and it just made me think maybe that women with lipedema, maybe we either produce more lactic acid, or maybe our bodies cannot
Dissipate.
get rid of the lactic acid as opposed to a quote normal person. Because if I work out too much, then I hurt. If I don't work out enough, I hurt. So I have to find that happy medium.
It's sometimes we don't appreciate the lactic acid lesson until we get older. When we're young, we think like you say, it's you gotta hurt to,
Yeah,
and to a degree, yeah,
innovate the
you
thing.
should feel, when you're changing the body, you know, the tear and repair mentality at the gym. I think a lot of people don't realize that exercise, changing your body, healing your body, all of these things, they do cause inflammation, and how that inflammation presents on you is different for
Yeah,
everyone. There are absolutely things that we've already talked about that you can do to support the severity of that and reduce it, but know to expect it. And one thing I see very commonly in the page when people use a vibration plate too much or try a new therapy, let's say, is sometimes when we push our body to a place of fatigue to get the toning or the weight loss or whatever it is we're working towards, we forget the difference between a eye exercise pain and the chronic stuff that you usually deal with. And so you come out of that MLD session and you're really sore the next day. Please don't associate it with the mentality of, oh, it hurt me. No,
yeah,
same reason with feeling fluish or whatever. But some of us have been unable to exercise body parts, or coming from such a place of severe symptoms that we forget what it feels like after we went for a big long walk, or did something new for the first time, because we get stuck in our self-care because we don't want to have that setback, or we're fearful of having a bad day. And sometimes that's part of the experimentation that you need to go through. But please don't be deterred if you have a bad experience. It's not, and I don't want to say bad experience, but you have an experience that isn't like you could go to Disneyland and have energy for 10 days, because there's certainly people that have that too. But for those
yeah,
of you that are drained, that you're in more pain, the swelling is more prominent, it is a process that you need to give your body time to get through. That's all.
yeah, definitely. And I was in that position not too many years ago where my back injury was keeping me from doing things. And I ran across Deb, and we had a little chat about the vibration plate and getting back up on it. But that was me years ago. I was scared because I did something that had hurt me, and I was already hurting. So I didn't want to do it.
Yeah.
So let's just do nothing.
And
So
that's protection. We kind of go
yeah,
into that fight or flight response. And it's great now that the groups have grown, especially mine, to a degree that are, not only in size, but I appreciate, I could talk vibration machines all day, but this is another example of it's never one thing. It's, there's my preferences and there's Jen's preferences, but the two gals on the screen here are the perfect example of a harmony of tools or approaches, if you will. But I do feel if you're dealing with lipedema, and you're unaware of MLD, you better understand what it is before you ask about a vibration plate, because it's not going to do all the work for you. You still need
yeah,
to understand, how that movement of lymph is going to affect you. And a lot of times, if there is an overswelling situation on a vibration machine, it is usually related to overuse. If it's pulled elsewhere, Jen is exactly the type of person I would refer you to. You need to go see someone that specializes and can take a closer look than me in my group and my texting comments, you've probably got some blockages in certain areas, or maybe it's scar tissue, and a certified therapist that can do this type of work with you can also help you understand where those blockages are, what you can do for self-care at home to help facilitate the good work that they're doing as well.
And if you will just give your body a chance with the MLD, um, and, and be consistent with it, and just start learning what your body is telling you after your MLD sessions. Because I know a lot of us live with chronic pain, and if we can do something for ourselves that just takes just a little bit of that pain away, I think that is a total score. MLD, if you will be consistent, you will start seeing a decrease in your pain. If you just will give it a chance and get over the hump, get past your body may respond to MLD where you feel like crap every time afterwards. In my opinion, that's just because you have a really great therapist and is helping you get rid of a bunch of junk. However, it does go back to the way you're taking care of your body on the daily, with your nutrition. But the MLD sessions will definitely start decreasing your pain. It will start, what will happen is it's going to start getting all of that inflammation. And when you have all the inflammation, you're getting the swelling. Swelling is pushing on those nerve endings, causing us a lot more pain. If we can do something to ease up the nerve pain, then that is a total score. So just be consistent, find a good therapist, and you can go online and research MLD. There's a lot of good information online. And if it's just finding a great therapist.
The best, do it yourself. Nobody's going to do that for you. No one knows how it feels to you. You know how I know that MLD, just it works, and why everyone needs to check it out is Jen is busy. Jen is so busy that she needs 4 more Jens. And a lot of it, she said before camera, a lot of it is that post-surgical client, pre-surgical client. And a lot of it is these people wouldn't be coming back to her if, even through all these reactions we've talked about today, they wouldn't be coming back if they weren't taking steps forward in that successful road to recovery. If you can't find someone in your area that you feel, sometimes you can tell just by talking to the phone on, if they're asking you more questions than you have for them. We're not saying just go see anyone. Perhaps the better investment in time is learning some self-massage techniques at home, the dry brushing, there's other things. But the big point is you got to do the self-care and invest the time, however little or much that may be, to do these things consistently. That's what's going to win the race in the long run.
And even if you have a really good massage therapist that you love and you have a good relationship with that massage therapist, most likely they will be open-minded enough to help you by letting you instruct them how to give you a massage, and what will make you feel better. Because if they're a massage therapist, they're in the business to make you feel better. They're just that type of person that they want you to feel better. And so I understand that you're not going to find an MLD therapist on every corner, but you can find a great massage therapist that you can help instruct how to perform a better, lighter, more lymphatic style massage for you.
And be part of the bigger awareness piece too. I know there's nothing worse than taking something like the standard of care or whatever in trying to educate those involved as care providers out there. But I will say from personal experience in all my years of dealing with vibration plates, I've always found my most open, complementary relationships have been with massage therapists, because I think massage therapists actually, better than anyone, understand the intricate workings of the lymphatics, the immunity, the skeletal structure. There's a lot of things physically that cannot be assessed through a quiz online. It's that physical touch that, you know, and all of you are so unique as well. And part of the reason I do these chats is, you know, I love my shaky machines, and I use and coach a lot of the therapies that Jen has, because many of you are lacking access to quality care. Part of the advocacy, I know we're past Lipedema Awareness Month, but advocacy shouldn't just be the month of June. You know, if you do not have massage therapists in your area that are aware of this type of massage, start demanding it, start asking for it. And I think you'd be surprised how quickly your local, you know, there's a lot of great massage therapists out there, but unless the demand for specific techniques or tools is being brought to their attention, why would they entertain it? So because of the work and the demographic, the type of folks that Jen is working with, it was in her radar early on, not just for her clients, but for her own self-care. I want to start wrapping up and say goodbye, but I think it would be very curious for those of you that don't know Jen and why I put massage therapists up on this pedestal. How did you find out about lymphedema?
How did I find out about it?
Yes, tell that quick story.
Well, I have a really great story. I had made a really, really good friend going through massage school, and she was a cancer survivor, and she was this little 4'11" girl. She was about 50 at the time. She was the picture of health and looked like a bodybuilder. She came to the office or to school one night, and her leg was the size of my leg, which is basically the size of her whole body. And so something I just told her, I said, Randa, this is not just, because she thought it was a pulled muscle and wanted us to work on it. And I said, no, this is not just a pulled muscle. So at that time, I said, you need to talk to your oncology doctor. So I talked to her the next day. She had seen him, and it was lymphedema. And her lymphedema therapist was horrible to her, and it was all about money. Not long after that, my mother-in-law was in a situation and was seeing the same lymphedema therapist in our town, and had wrapped her arms so tightly that her fingers were blue. And so this got my brain to cooking, and I was like, I've got to learn more about lymphedema, what it is, why it happens. And so that's what I did. And as soon as I got my certificate to be a massage therapist, I was like, I'm finding a school that will teach me how to treat these patients, because they need help. And obviously we don't have anybody in our town.
Yeah. Yeah. And I think that's the case in a lot of places, you know, so whether you're doing the research for your own self-care or perhaps someone you care about, again, we can't stress enough, it's not a matter of just going to the local shop on the corner, and be curious, ask questions,
Yeah.
you know, do
And
some research.
don't blame your doctor that they don't know what lymphedema is, or lipedema. Don't blame your therapist that they don't know what lipedema or lymphedema is, because it is simply not taught. I mean, I literally probably had a 12-sentence paragraph in my massage book about the lymphatic system,
Which is such an integral part of massage therapy work.
Yeah.
Right?
Yeah.
It's where the rubber hits the road versus what the tech, you know, it's like anything in life.
Yeah.
You know, how much of that math are we really going to use after graduation, right? So I you know, I appreciate you shedding some insight. And for those of you that may be joining us as massage therapists, if you are not certified in lymphatics, it's certainly something. Imagine if everybody knew about this. You know, this has been my thing all month. Imagine if the education and understanding for lipedema, and I'm going to say lymphedema because it does have a little bit more press. Imagine if it was as commonly known as diabetes. Diabetes is 1 in 9. And I'm thinking, I know everybody says 1 in 10 or 1 in 11, but it's close enough. Imagine if we had the tools and the resources and the understanding for lipedema and lymphedema as we do for diabetes. I can guarantee every massage therapist on the planet and all these schools where you could learn how to do manual lymphatic drainage would be cropping up. But the difference between Jen and someone that is just looking at school. Jen's got years of hands-on experience. So if you therapists out there that have a practice, you know your clients are dealing with issues. I dream of the time where this is a prescribed treatment. I'm not saying it's out there now, but like many of the gifted medical folks I worked with, nothing replaces time on the job. So it's that tenure, that experience, all these nuances, and many of you that are massage therapists out there, I know you cannot offer a diagnosis, but you certainly can shed some light. You know, if it's going to improve your patient's self-care, the more versed you are, and that you can have these conversations with your clients, because it's not a common conversation we can have in the medical environment. So thank you for those of you out there that are open-minded and having these discussions. Self-care isn't about a diagnosis. It's just about, you know, finding that community, or those like-minded individuals that can relate to the situation and point you in the direction of the tools, or the you know, the disciplines that you should be exploring. So thank you for being one of those, Jen.
Absolutely. And if you are a therapist, I would encourage you to get some education about the lymphatic system, because the last I knew, about 13% of the women in the United States have lipedema or lymphedema. Yeah. And so that's a lot of people that are on your, a lot of women on your table that you're seeing daily that you could help.
And you must know that something is different with that physical touch. It doesn't feel the same. It doesn't move the same. The temperature is different a lot of times. Cold, hot thing. There's all these nuances, and I don't know what the stats are as far as number of massage therapists versus those that are licensed for MLD. But I will also state, Jen touched on this before we say goodbye very briefly. You know, she can't get a diagnosis in Arkansas. It is a by state thing. So the last question I want to present to Jen, but it's not really her question to answer. She's going to bring it up with an experience, but is it covered by my medical plan? You know, it really depends on the plan. It's not the treatment. It's like anything else, depends on the plan, depends on where you reside, depends on your doctor. So, you know, how much your plan or what it will cover, I would assume varies by state. But if you are talking to an insurance company about getting this covered, is there anything specific tip-wise that you could offer, or it's pretty black and white?
So the horrible thing with a lot of the insurances is it will only cover, it doesn't matter. And even like Medicare, it will only cover a certain amount of sessions. I believe with Medicare, it's like 10, maybe 20, for a lifetime, not per year, but for a lifetime. And it all boils back down to a diagnosis from your doctor if you're wanting insurance to cover it. In the state of Arkansas, as a massage therapist, I still will not even be recognized by an insurance company for payment of lymphatic therapy. Even though I have tons of training, I'm very knowledgeable, even more knowledgeable some of the doctors in lymphatic therapy. I still will not be considered to get payment from an insurance company. So
things to keep in mind. Things to keep in mind.
It's really just going to always boil down to if you have a diagnosis. And typically, I know with Medicare, and I also know, this is just, I'm speaking for Arkansas. I work with a rehab center in Fort Smith, and they always put you on a pneumatic pump. That's their solution. And a pneumatic pump is great. I have a pneumatic pump, but it still does not replace MLD.
But it's a covered service, so they can bill for it.
Mm-hmm.
Sometimes you got to keep in mind, you know, as Jen and I were talking about the research earlier, you know, just because it's a covered service or it's a known service, it doesn't mean it's always the best approach. Many of you look at me, oh, must be nice up in Canada with your free healthcare. Well, that's a big general term. You know, it's free if it's the course of treatment that is approved, and that is very rarely in my wheelhouse. So, you know, free healthcare versus, you know, what is paid for because it's profitable aren't always necessarily a good thing. So, you know, I don't want to say that, yes, you know, this may be out of pocket, but I think if it, out of all the things out there that are out of pocket, this is probably one of, you know, think of this as one of your ice creams. This is something that you need to
Yep.
consider at least trying, whether you get coverage or not, and not just trying once. You know, I would suggest, you know, if you do have access to someone locally, you know, give it a few sessions for all the reasons we talked about, and escaping that, you know, self-serve, and see what you can find online. I can't stress it enough. Those of you dealing with these conditions are the most versed and the best equipped to manage the self-care, because nobody knows your condition and like you do. That's really what it boils down to. And to Jen's point, where you're directing other people, you know, sensitivities, it's okay to be vocal. You know, if you are going to see someone and it's hurting you, or you feel it's, you know, it's something you wouldn't go back for because of the experience, you're not doing them any favors by not being vocal. You know, explain to, you know, maybe they're not aware of your sensitivities because you don't want to talk about them. You don't want somebody else to not know what you have. I know it's hard constantly, you know, getting that door slammed in your face, but my experience in the massage therapy world is completely the opposite of dealing with the medical establishments. So
Yep.
that's a door I suggest you walk through.
Yep.
Fair? Cool.
Fair.
I always
Yeah.
love talking with Jen. We could probably talk for 3 days because it's been too long. And like I say, I know she's at the beach and enjoying some well-needed vitamin C time, or vitamin D time. So I'm gonna let you and your sweetie get back to that. And I can't thank you enough for joining me on your off time.
Absolutely. It's so good to see you as always.
You as well. You as well. Enjoy the rest of your week off. Jen is back next week. I do have a post in my group about, you know, share your services. Jen is one of the services that are shared there. But I do invite, if you are a certified lymphatic therapist, or this is something that you yourself are curious or working towards. We don't have as many conversations about this in the group, but it's okay to have conversations about other things in my group beside vibration plates, because I think MLD is one of those staple treatments, as I said, that is enhanced by using a vibration plate. One is never to replace the other, in my opinion. You know, they offer similar benefits, but they have different purposes, is what I will say. So thanks again, Jen. You and your sweetie enjoy the rest of your trip, and
Okay.
have fun getting back to it next week. Don't burn yourself out too quick, okay?
Yeah, absolutely. And I love to talk lymphatics. So if you're out there and you are a therapist or you just have questions about it, just
Yep.
hit me up with a message and I will certainly reply.
And maybe a follow-up session next month. Like I say, I know June can be so inundated with so much talking, that, you know, sometimes you don't even, I'm just getting back to watch some of the stuff that I meant to watch earlier in the month. And, you know, it's all about planting seeds. And sometimes it's just a reminder. Consistency is the key. And as you know, I'm awesome about nagging each of you. So thanks for joining me, Jen. Enjoy the rest of your trip. And
Okay.
if you have any questions, for those of you that are watching the recording of this, or are curious about anything, please post that in the comments. And I will put contact information also for myself and Jen, our social media, her business. If you are in the Arkansas area, you should go buy her an herbal tea and have a visit. So thanks for joining me, Jen. Have a great rest of the day.
Bye.
Bye now.